Morning, Wise Tribe. We are live at Osler Health with Dr. June Tan Sheren, and we're here to talk about HRT, and we're here to talk about the myths and understanding the facts and just making sure that we're all on a understanding of what HRT is for and who it's for. So thank you for joining us today.
Thank you, Anju. It's lovely to be here. Thank you for having me.
So you have a special kind of interest in women's health and menopause, HRT, all of these issues that affect us. Just before we dive into HRT, can you tell us a bit of a recap in very clear and simple terms about menopause, and what is it that we're trying to treat with HRT?
That's right, yes, that's right. It's important to understand what the menopause entails. Really, the menopause is a time of women's lives when the ovaries do not produce estrogen or estrogen. I will use them interchangeably any longer, and that really affects many different systems of the body and can have very profound effects on the brain, the heart, the bone. Osteoporosis, I think most of you will know, is a major complication that occurs after the menopause. It affects the skin as well. So essentially it all boils down to a deficiency in estrogen and in the stage of life, and this can occur anytime between the age of 45 to 55. The most common age at which women reach menopause is 51, but the changes, the hormonal changes and the fluctuations do often start from as young as 45. And so essentially what we're concerned about is the dropping levels of estrogen, and the treatment of menopause and symptoms of menopause is really directed at replacing the estrogen, and hence hormone replacement or estrogen replacement. In Australia, HRT is now known as Menopause Hormone Therapy, MHT, removing that term replacement. But essentially that's what we're trying to do, to replace estrogen in order to restore function.
Okay, so HRT is about replacement of the hormones. How does that take place? What are the different types of HRT that are available?
Many different types of HRT available, Anju, and a lot depends on the individual's preference, the individual's medical history, whether it's a past medical history as well as existing medical history. Also, the family history is important, lifestyle factors are important. Many different types of HRT in terms of, if we think about first the route of administration, how it's delivered. It depends on whether we're trying to manage systemic symptoms such as hot flushes, night sweats, low mood, insomnia, or if the aim is to prevent osteoporosis, then what we want is to prescribe a systemic form of HRT that's taken and distributed to the body. So that can come in the form of an oral tablet. It can be a transdermal HRT, meaning it's applied to the skin, so it can come in the form of gels, patches. Although in Singapore, at the moment, patches are not available. The gel is very much easily available. So that's systemic HRT. The other aspect of replacing estrogen relates to local treatment, vaginal estrogen replacement. And for that, if that is the only indication for using estrogen replacement without the need for systemic use, then there is vaginal estrogen that's available in pessary form for insertion or as creams as well. So very broadly, those are the two groups of HRT to think about, whether it's the systemic route that's more suitable for you or the vaginal route. And then in terms of the types of HRT, there are different combinations as well. To break it down into very bite-sized portions, we're looking essentially at whether a woman needs an estrogen-only HRT, so E only, or estrogen and progestogen. This very much depends on whether a woman has had a hysterectomy And the reason is that in a woman who has a uterus intact, it is important that we add the progesterone component, because the P, we call this the P component. It's important for some protection of the lining of the uterus that's provided by the P component. If there is no P on board, then estrogen by itself can overstimulate the lining of the uterus, and that can lead to some problems. So in all women who need systemic HRT and who have a uterus, who have not have had hysterectomy, then it's important that they have a combination of E and P.
Got it. Very interesting. So in those terms, is it when you feel certain symptoms that you should then pursue this line of treatment? How do you know whether you need HRT or not?
Good question. So for most women starting from the age of 45, if they are starting to feel some symptoms such as hot flushes, night sweats, low mood, decreased libido, or even vaginal dryness and irritation leading to painful sex, it's important, I think, first and foremost, that awareness needs to be there. Yeah, women need to understand what the possible symptoms of the menopause or the perimenopause, which is the stage before a woman actually reaches menopause, what these symptoms are. And as to whether HRT is going to be beneficial, that has to be a good conversation with a healthcare professional like a doctor. How do I help patients decide what they need? We go through all their symptoms. We go through the severity of their symptoms as well. This actually very often is subjective. Yeah.
Right.
In the past, we would grade, say, the severity of hot flushes and say, oh, if you've had more than 20 a day over a period of a week or so, oh, we grade that as severe. And if not, then you don't need HRT because it's not considered severe enough. That's out the window now.
Okay.
We go by what's recommended is using a symptom score chart that's available, easily available online, and we use a grading scale of 0 to 3, 0 for none, no symptoms,
Right.
1 for mild, 2 for moderate, 3 for severe. And we ask patients to grade all of their symptoms, and then we look at what the patient is experiencing, what the woman is experiencing, and just how that's impacting her overall well-being. And that's where I will come in and say, okay, let's look at whether HRT will benefit you, and at the same time I'll ask about medical history. I'll go into a lot of detail to check if there are any medical contraindications, there are any medical reason why this individual shouldn't be using HRT. So a lot goes into the consideration there, the recommendations.
Yeah, so it's really important to understand that it's not a one-size-fits-all.
Absolutely.
If you have X, Y, Z symptoms, then you should go for this type of therapy, or if you have X, Y, Z symptoms, then this method, is going to be better for you.
Yes.
It's all about the individual and having that conversation, because everybody feels things differently. As you said, it's not just a question of a stock standard check form and okay, she's at a level 5, therefore this applies.
Right, exactly.
Everybody feels things differently, so I think it's important to have that in-depth conversation and understand how it is.
Absolutely. No two women are alike. No two women experience the same symptoms. No two women experience the same impact that those symptoms have on them.
So if you're discussing with your friends, for example, and you're chatting about HRT and how it is for them, and I mean, in terms of advice from your peers and things like that, I think it's difficult to sort of swap notes. Is that right?
Yes, that's right.
But in terms of benefits and the upsides and the risk factors or the downsides.
Yes.
I think a lot of people will be swapping notes about their experiences.
Yes,
so
absolutely.
Can you tell us a little bit about what people might experience once they're on HRT,
right,
and the benefits that they might feel?
Yeah. So we would expect that when a woman starts HRT for certain symptoms that she will respond, because essentially we are replacing a hormone that the body has stopped producing. Yeah, so an improvement in symptoms, improvement in well-being, and on top of that, it's important to think about and realize that there are good long-term benefits of HRT on other parts of the body as well. So bone protection, I mentioned, HRT has long been established as the first line prevention and treatment of osteoporosis in women under the age of 60. So that's very important for many women to realize, especially in Asia, where the Asian diet is actually very lacking in calcium as well. So that's important.
I didn't realise how important it is actually, because I was doing some research for this talk as well, and one of the things that I heard was that when there are complications due to osteoporosis and fractures and hospitalization, it can actually be really a really complicated thing to treat.
Absolutely.
And actually there are many deaths from it.
Absolutely.
I was really shocked to hear that.
It's quite shocking, yes. The statistics.
What an important aspect
exactly
of HRT and menopause management.
Exactly.
Osteoporosis.
That's
really
right.
is.
Bone health is a very, very big part of managing any woman in the menopause. And osteoporosis being a silent disease, it's the aches and pains that a woman might experience. Those are not symptoms of osteoporosis.
Right.
There are just no signs or symptoms until a break occurs, a fracture occurs, and by then it's the numbers in terms of mortality and morbidity are really shocking.
Yes. So it's really important to talk about that. And also you talked about the other vital organs that affect the brain, the effect to the heart.
That's right. So with cardiovascular, with heart disease, and this has also been established for a long time, and back in the 90s, before the big controversy, big news occurred with a very unfortunate publication almost 20 years ago now. Now it's been well established that HRT plays a protective role for the heart. It helps with cholesterol, it helps with blood pressure, and we know that many women at the onset of menopause have quite an exponential increased risk of heart disease and heart attacks, and together with the risk of diabetes and high cholesterol, high blood pressure. So it's very well established that HRT plays a very important cardiovascular protective role. And the evidence now is that HRT is known to be very beneficial in this area if started soon after the menopause, as soon as a woman is diagnosed to be in the menopause. Then the benefits of HRT in cardio protection actually begin at that time and last for quite a number of years. So that's a very, very important thing to bear in mind as well. In terms of the brain function, we know that some degree of cognitive impairment, short-term memory loss, brain fog, exactly, very, very common symptoms in the perimenopause and the menopause. Now, there's been a lot of studies and ongoing studies to try to figure out if HRT has a protective effect against dementia in the long term. At the moment, studies results are conflicting. We don't have a clear answer as yet. 2 weeks ago, you'll find a paper that says, oh, there is benefit. And then a week later, you read on the BBC, no, it wasn't the risk of dementia. Right. So the verdict is out. We don't have clear answers yet. But yeah, hopefully that is a benefit in the long term that we will see as well.
And other overall benefits in terms of well-being and in terms of solving some of the problems, treating some of the symptoms, but broader, the effect on sleep.
Absolutely.
And just general well-being.
Exactly, absolutely. We know that HRT and replacing that bit of estrogen does help many women who are suffering from insomnia, from sleep disturbances, which can occur without night sweats. You'll find that many women are not sleeping well, not just because they're woken up with drenching sweat, but just because of sleep disturbances, insomnia that occurs during this stage of life. And just how important that is. Without the sleep, the fatigue gets compounded. Just how important that is in improving well-being. It's so understated.
So it can have effects of vitality.
Exactly.
And help you just to feel a little bit more with it, I guess.
Absolutely. Absolutely.
Well rested, you're present, your brain's more active and functioning.
Exactly.
Which generally makes you feel better about things.
Definitely. Exactly.
What it's like if you've had a good night's sleep.
That's right.
You feel ready to go.
Yeah, exactly.
Another little side benefit that I heard about in my research was about collagen production, which I thought was really interesting.
Right.
As well.
Yes. That's
so it's
right.
a little secret about HRT that it can kind of help to boost your self-esteem as well in terms of looking better, feeling better.
Absolutely. We know that skin elasticity drops with the drop in estrogen. So replacing the estrogen certainly will help in that respect as well.
Yes.
Yeah. Not to mention also somewhat related, vaginal dryness, vaginal what used to be known as vaginal atrophy. This whole it's called genital urinary syndrome now of the menopause. And that again boils down to a deficiency of estrogen in the lining of the urogenital areas, and that replacement is so helpful in just restoring and the health of the vaginal lining altogether. Many women also suffer from repeated urinary tract symptoms, and many times they go to their doctors repeatedly to test for UTI, and the result keeps coming back normal. And we're wondering just what is going on, and very often it's because of that lack of estrogen in the urinary vaginal area. So that's another very important system to think about.
So we've talked about the benefits and the plus sides. Before we talk about the risks, I've got a quick question that's just occurred to me. When we're talking about HRT, how long are we talking about this therapy going on for? Is it for the rest of your life, or is it for a certain period whilst you're experiencing these symptoms?
Yeah, the guidelines currently state that the benefits of HRT would be most appreciated, best felt in women who start HRT within 10 years of the menopause, or before they reach the age of 60.
Yes.
The guidelines do not say that there is a limit to how long women can take HRT for. There is no arbitrary upper age limit either. And as long as we keep track of symptom improvement, we keep track of any ongoing medical conditions to follow up on, such as breast examinations and etc., then overall the benefits outweigh the risks in the vast majority of women. It's not often that we would say to a woman that, okay, you're going to stay on this for the rest of your life. A lot depends on what's needed. Many women do, after several years after the menopause, do have an improvement in their systemic symptoms such as hot flashes and so forth, and they can choose not to continue to use systemic HRT. Vaginal symptoms, though, often do continue and get worse after the menopause. And the guidelines do say that it is safe to continue using vaginal local estrogen for as long as needed.
Okay.
So
so you might review your treatment type
exactly
after a certain amount of time.
Yes, that's right. In fact, we encourage, and I'll have patients come back once they're established on HRT, to have an annual review. Annual review with your GP is a very important part of keeping up with things.
Which you would advise anyway, as a kind of well-woman check-up anyway.
Exactly,
so it's all part
routine
and parcel.
screening. Yes.
Great. So the risks. Let's talk a little bit about what we should consider.
Yeah, absolutely. So 20 years ago, a big study known as the Women's Health Initiative was released, and that had major ramifications on prescribing pattern and the use of HRT. It reported an increased risk of breast cancer, significantly increased risk of breast cancer, heart attacks and strokes in women taking HRT, and that was just major, you know.
Very damning.
Very, very damning, that's right. A lot of press reports all over the world. Patients, women and doctors were scared. I think statistics show that about 66% of women stopped using HRT, and that figure has continued to increase. Currently, there are studies that show that maybe only about one to two, less than 20, or closer to 10% of women actually are still using HRT.
Right.
So those risks have been re-examined more recently through lots of new trials, new studies, and analyses, in fact, of that original trial that found a lot of flaws, in fact, in how it was conducted, in the interpretation of the results as well. And we now know that the guidance is that the risks of breast cancer are in fact very low in the majority of women, in women who are at low risk of breast cancer altogether. The risks are very low and the benefits will outweigh the risk. Another important thing to note is that we're now using newer versions of estrogens and progestogens.
Right, that study was 20 years ago. So
Exactly. We've moved on. We're using much safer compounds, much safer versions of estrogens and progestogens now. And there have been studies showing that the newer versions of progestogens, in particular the more body identical versions of progestogens, are in fact not associated with any increased risk of breast cancer within a 5-year period. So that's very exciting. There's been a lot of data on that, as well as risk of blood clots. Again, the use of the newer body identical progestogens have been found to be not associated with increased blood clots, strokes or heart disease within a 5-year period. So it's all very, very positive data that we're having now in terms of risks.
Why isn't this good news publicised?
I know.
It's all the bad stuff.
I'm not sure why. It's very puzzling.
Yeah, well, that's good to know. So in general, the risks are very low, but obviously you would talk to anybody about their specific history and concerns, depending on their background.
Exactly.
If somebody feels that HRT, for whatever reason, is not for them, it's not an avenue they want to go down to, what are the alternatives that you would suggest in terms of hormone replacement?
Right. There are reasonably good alternatives. There is one product called Tibolone, which is a synthetic product that has some effects of estrogen, progestogens, and testosterone as well. This product came about in the past 10 to 20 years because of that reluctance to use HRT, and it is seen as a gentler form of hormone replacement. However, in more recent years, because of just so much good evidence with conventional HRT, the use of Tibolone has fallen down in favor. There is also another newish product called Duavi, not very commonly used in Singapore. It's a lot more recent, and again, came about because of the reluctance of healthcare professionals to use HRT in the previous years. However, that's again because of the new findings and new positive findings with HRT hasn't been very popular anymore. Those would be the alternatives. In women who have had a history or have active breast cancer or uterine cancer, which are contraindicated in the use of HRT, then we'll have to look at non-hormonal alternatives to treat women for their symptoms. And we do know that for the treatment of hot flushes, antidepressants work quite well. In fact, up to 70% effectiveness.
Wow.
Yeah, with the use of certain SSRIs like citalopram, sertraline, or SNRIs, venlafaxine, traditionally used as antidepressants, but actually are quite effective in treating hot flushes as well. So there are different options, non-hormonal options, that are very important for women who absolutely cannot be using any hormones.
Yes, and who may not want to be for whatever reason. Everybody has a different idea about their body, and they should have those options. So it's good to know that they're out there.
Absolutely.
Thank you very much, Dr. June. I think we've covered a lot of important ground today.
My pleasure.
Are you okay just to hang around and answer any questions that might come up in the next
Sure, I'll be very happy to.
Half hour or so? I can't see any questions that come up so far, but we'll be here if you want to DM me or send any questions. Please do come and inquire with Dr. June at Osler Health if you have any concerns about HRT or want to get a consultation or a screening and just have a check-in with what's going on. She is available. So thank you so much, Dr. June.
Thank you,
it's been
Anju.
really wonderful.
Such a pleasure. Thank you. Thank you.
Thank you. See you again, Wise Tribe.